Hello, how are you? Today is a video all about what a speech and language therapist, also known as a speech and language pathologist, is, and what the role is, what it entails, who do we work with, what are the clients, kind of skills you need, or not necessarily need outright, but will learn as well. So, hi, my name is Emma. I'm a speech language therapist working in the UK in London, and I just want to give like a bit of a rundown about what the role is, because I didn't actually find out what the role was until I was doing my degree. So if you're at this point and you're just learning what it is, stick around and I'll give you some info. First, in the UK we are speech and language therapists, and then in Australia and in America we are speech and language pathologists. So it is the same role, and if you have a qualification in the UK, you can use that in the US, in Canada, in Australia. Your qualification is recognised there as well. So let's start off with the very simple, what is a speech therapist? A speech therapist is someone who assesses and treats children or adults, or sometimes both, who have either a communication difficulty or a eating, drinking and swallowing difficulty, or sometimes can have both. I'm just going to tell you a bit about the kind of patients that we would expect to see, the things or difficulties that they might present with. So the kind of presentations we might get with children are speech disorder, hearing impairment, selective mutism, language disorders, so that could be like developmental language disorder. And then for adults, you can have neurological and degenerative disorders. So for example, a stroke, and then you have progressive disorders like Parkinson's, motor neuron disease, Huntington's disease, multiple sclerosis, and dementia as well is quite a common one that we see, and we support patients with that. Then things that we see in both adults and children are voice difficulties, swallowing difficulties, mental health. It doesn't tend to be in the much younger children, but sometimes it does, but typically you'd see that in the adolescents and adults, I think, more that we would work with, but maybe that's just from my experience. Maybe it is more common than I think. And also learning disabilities, both adults and children, and stammering in both adults and children. Stammering you can acquire as an adult, but it is more rare. But we can still work with children with stammering and adults too. So speech and language therapists work in a variety of locations. So they can work in hospitals, in community clinics, in schools, that can be secondary, primary, or nurseries as well. They can work in patients' homes. They can work in nursing homes, they can work in rehabilitation centres, they can work in hospices, prisons, in outpatient kind of places, in hospitals, and education centres. And so the kind of things, like what do we do to help, is we will use different assessments depending on the child or adult and their needs, and depending on what we're wanting to assess. So these can be informal assessments, which tend to be more kind of information gathering and not a formal standardized assessment. And then we also do standardized assessments, which have been previously tested and assessed on lots of different people to kind of get some norms, and then you can compare your scores or results of their assessment to those norms to kind of see the level of difficulties they've got and in what areas. So we assess, and then we also, based on the results of the assessments, we would develop a personalised kind of treatment plan, and that will vary depending again on the person. And the whole idea is for it to be person-centred. So we want it to be something that the patient wants to work on themselves, or they've highlighted an area of difficulty, or you're kind of working like collaboratively with a patient. And what else we do? We work with lots of other professionals. So we work with occupational therapists, physiotherapists, doctors, nurses, psychologists, so many other people as well, HCAs. HCA is a healthcare assistant. So we work with a whole broad range of other professionals and work collaboratively with them to support the patient and get the most patient-centered care. And also, I guess, kind of ties into that is we provide training and education to other professionals, and we also provide training and education to patients or clients and their carers. So for example, if someone has a swallowing difficulty, we do an assessment with them and we find out that they're not safe on certain consistencies because there are overt signs of aspiration, so that could be coughing or a wet voice or something like that. We might make alteration to their diet or their fluids to try and support them on their intake to reduce the chances of getting chest infections. And so we would do that assessment, we would find that, and then the treatment plan would be to, I don't know, make their diet a level 5 mince and moist diet because it makes it easier for them to chew up, and then it's less likely risk of choking. And so we might provide education to the patient about why we've made those recommendations, or the carers of whoever it is who kind of provide that education as well. And also lots of patients that we see, for example, don't prepare their own meals, so it'll be kind of providing education to their carers to prepare those meals into those textures, and maybe they support with eating and drinking, so maybe we can educate them around the signs to look out for if their swallowing's deteriorated. So that's kind of like an example with swallowing. And then a communication example might be with a child with a speech disorder. We might use, I can't remember what it's called, the Clear. So we might use something called the Clear, which you get a child to label lots of different pictures, and from those pictures that they've labelled you can work out the speech sounds errors that they are making. So that would be the assessment, and then you might then pick out some of the errors that they're making. You might choose the errors that the carer notices the most or the patient notices the most that upsets them the most, and you would then work on those. Or you might work on the speech sound that should have been developed earlier if you were looking at a typically developing child. And then we would work on that speech sound in isolation as part of the therapy, and then you kind of progress it into words and then sentences, etc. So that's kind of like a broad thing. And then in terms of what you might do with the swallowing difficulty as well to collaborate other professions is you might bring in a dietitian because they might not be getting the nutrition and hydration that they need from the recommendations you're making. Or you might need to bring in a pharmacist because they aren't able to swallow tablets, so they need to have their medication altered. Or with a child with the speech sounds, I think that's probably not the best example because mostly speech therapists would work on it, but also it might be a child that's got other things going on, and maybe they've got some sensory needs, and then you might bring in the occupational therapist. So that's kind of like an example of how we would create a personalised treatment plan. We might execute some therapy with them, or might set a program so they can do it themselves and you can kind of monitor, and integrate also with other professionals as well. So the skills needed or to be learnt to be a speech therapist, I think I've come up with quite a few which I think would be very helpful. Some of them aren't essential and, like I said, can be learned. So the first one is communication skills. I think that's so important because you're communicating not only with the client specifically, but their family, next of kin, carers, other professionals, and there can be difficult conversations, there can be conflicts. So having those basic communication skills that can be developed further in ways that you can learn and improve is really important. And the next one that I was thinking of is problem solving. I think that's really important because loads of problems arise in the job, whether it is related to you carry out an assessment and you're trying to work out where the problems are for that person in the assessment and how you can help them, or it might just be something simple like, oh, this patient's gone there but they actually need to be here at this time, how are we going to resolve that when we've only got like 30 minutes? And I guess also what comes into that is working out your prioritization as well. Prioritization, organization and problem solving can kind of interlink a bit as well, I guess. Also be able to work independently. I think that is important, you know, for writing your notes, writing reports, especially if you work in a community kind of role as well, because often you'll be going to people's houses or going to different nursing homes, for example, so you might spend more time by yourself in comparison to somewhere like a hospital where you're often surrounded by a team, or if not, it's the speech therapy team, speech pathology team. It would be other professionals would also be there with you. And then in the contrast, you also need to be a good team player and team worker. I think it's a given, not surprising that you need to be a good team player based on everything that I've said in relation to working with not only the child, the carers, next of kin, and other professionals. It's important to listen to others in your team, and your, so I think that's really important. I think empathy is very important as well.
I think the reason I've paused it here is because I go into a big blab about empathy and then I find that actually it's not very helpful, and so I just thought I'd add here that I think empathy is important, and if you don't know what it is, it's the ability to understand and share feelings of another, which is kind of self-explanatory, I think, as to why we need it in speech therapy.
And also professionalism. I've just googled what professionalism means, and well, no, actually this is what it means to be professional, and it's to have made a public commitment to a high standard of performance, to integrity and to public service. So I think being committed to the role, demonstrating your knowledge and skills so that you are trusted, and also you are providing a service and you want to do that to a really high standard. So I think that's really important too, and that is something that I do feel like I learnt in previous jobs, but probably quite a lot at university when I was on placement as well. So like I said, these all can be things that I learned. I'm just going to speak about the UK because that is where I trained and more what I know about. But how to become a speech therapist, and there are 2 ways you can do it. There is a third being introduced, but I'm not sure if it's fully been ruled out yet. So the first way to do it is to do a 3-year Bachelor of Science. I think they're only Bachelor of Science, I don't think, and they're honours as well, but I don't think they're BAs at all. And it is an NHS course. It's not funded, but you do get a £5,000 grant per year of the course, and then you pay normal fees. I think it's what, 9,250 these days per year, plus if you're living somewhere then it's their maintenance on top of that, so it is expensive. And the other way you can, or the second way you can do it, is a master's degree, and that is the 3-year course but combined into 2 years. So the master's is a 2-year course and is an MSc, and on both of those courses you do your learning, education, and you also do placements throughout, so you work as a student in different settings. Well, I say work, you don't get paid, but the aim of placement is to experience how the speech therapists work in the industry and also learn how to do assessments and therapy, etc. in those different workplaces. So that's the idea behind those, and that's obviously very valuable. And then the third way you can do it, which is, like I said, it's not, I think it has been introduced, but it's not really been explored yet by many people or trusts and things, I don't think, but it is like an apprenticeship. So you work as a speech therapy assistant and you attend uni alongside it. Someone in my last trust actually did it as an occupational therapist, so I think it was a 5-year course or 4-year course. You get paid full time, you also are then learning on the job, so you go to uni, you have your assessments, and then you work also. So yeah, they're the 3 ways you can become a speech therapist in the UK. In other places I'm not sure, but if you do know, please comment down below. I know a few people have kindly commented before and said, oh, I'm not from the UK, but I've learnt here, so it would be really interesting to see kind of how else other people do it. But I just thought this was a bit of a summary of what a speech therapist is, because I think once you're in it, you forget people don't know, but I didn't know what one was till I was like 20. I'm assuming lots of people don't actually know what it is. So thank you for watching. It was really nice to catch up again, and I will see you in the next video. Bye!